first, you're probably noticing that when you get in the room, you're actually muted. That's a good thing. So we want you to stay muted, but we're also going to have several points within our presentation today where we really want to invite you to come in and have a conversation. And so we're going to ask you to see where your name is. You're going to see a little hand that you can raise your hand, and then we will be unmuting you so that you could actually join the conversation. So please make sure you do that. Now, if you're a little audio shy, you can also just ask questions or join the conversation via chat box. Second thing is that you will notice you're not on video, and we'd like for it to stay that way because with a couple of hundred people on the line, it'll just get more confusing. So we'd rather not do that. And to make it even more direct for you so you could actually see who's speaking, we'd like for you to look at the top of your screen, and you're going to see where you have an option that says speaker view. It's like a white rectangle with 3 white dots on that. You click on that and Zoom will actually show you the video feed of the person who's speaking. So that seems very neat as well. Okay, so probably the most important part for many of you right now, I can talk about CEUs. Yes, we are offering CEUs for today, and that is, as usual, social work, mental health counseling, and CPRP. We ask that you look at your emails, because within 24 hours of today, we will be sending you an evaluation. So if you've been with us before, you know how this works. We take your attendance, so just by the very nature that you're here today, we have your attendance, and then we take your evaluation form and we connect those two, and that creates a loop, and then all of a sudden you are eligible for CEUs, and we're able to generate a certificate for you and send that off to you. Now, typically our standard return time is 30 days, but please understand that we're doing several webinars since March, several webinars a month, and we're also getting hundreds and sometimes thousands of people on these webinars, so the turnaround time might be a little bit further along. And just to close that loop, to let you know that this video of today's recording, as well as the PowerPoints, will be on the NIAPRS website, and we will do that by the end of the day today. Am I done? I am done. This is great. Now I'm going to hand it off to Harvey Rosenthal. Thank you all for listening.
Thank you, Ruth, and thank you for all your great work for us here on these webinars and all the work you do throughout the whole pandemic. You've been making sure our message is out there, and you've touched a lot of you and your team. And I want to just remind people, if you go to our website, www.niaprs.org, every day Ruth has a meditation sort of video, and I've used it a couple of times. It's really quite remarkable and really inspires a lot of peace, and peace is a good thing right now. So thank you, Ruth. Your kindness really comes out in those things. I appreciate that. And I want to thank Eileen, who's in the background floating. You can't see her, but she's the person who sets these up and is always there if we need her. So I want to thank you for joining us. I'm Harvey Rosenthal, CEO of NIAPRS, especially during these unimaginable times. Somebody said the other day that if you think back to the pandemic in New York City in 1918 and the great crash of 1929 and the civil rights movement of the 60s, we're all experiencing that right now, all at the same time. So this is really an extraordinary time. We will never forget it, and we will never forget how people have stepped up here in so many ways. The murder of George Floyd has just torn the roof off of the conflict in this country, the racism that is so deep and shows up in all kinds of ways. We'll talk about it today, in white privilege, but certainly I'm going to talk a little bit about criminal justice for a minute, because it really shows up there, and it's a strong concern for us. So it's no longer acceptable, and one of my hopes is when you see people of all colors marching and police involved in that, there's some hope in the middle of all this. So I just wanted to also talk a little bit about NIAPR's sort of commitment to the issue of racism. We've been talking about it in our events for quite a while, thanks to Edie Schwartz in particular. There's a real focus on racism. We've had it in our tracks at various events. We've had it at our keynotes. We had Hawk Newsom from Black Lives Matter, he's the lead in New York City, with us a few years ago. It's a track in our conferences, and the Cultural Conference Committee is holding webinars on a regular basis. And there's a real tie-in between that committee and the public policy issue, because the overrepresentation of people in color, especially African Americans, is unconscionable, immoral, and devastatingly a torturous experience. We should all be ashamed of the way this has gone down. Right now in New York state hospitals, there are, in jails, in state prisons, 900 people with mental illnesses are in solitary confinement. The overpopulation of African Americans in particular, with suicides, with COVID in the facilities, I was reading a statistic today, I won't go too much longer. In 2018, the white population was 55%, 33% were arrested, 28% of those were sentenced. African American population is 15%, but 38% were arrested, and 48% had sentences over time. So if that doesn't say it, that's why we work so hard on trying to really, with crisis intervention teams, to divert people, to work with police not to escalate. God forbid what happened there, We work with people and police not to escalate the situation, not to arrest, and to make a good sort of referral and see the humanity in people in the middle of a crisis. We work in the prisons desperately to get a law passed that will ban solitary confinement for people with mental illnesses. And we're working, on a Medicaid waiver that will allow services to come into the jails, prisons, like a month before people leave. These are so necessary and they're fundamental. And I shouldn't do this, but I call on Governor Cuomo to sign that bill. All right. I'm very pleased to introduce, we have a special panel of national and state experts on a topic that is so germane. By the way, I just want to point out, this is one of 3 webinars this month. On June 10th, we're going to have a very exciting one, the Wellness Recovery Action Plan that Advocates for Human Potential has been overseeing, worked with the Copeland Center to create a special adaptation of RAP called the Wellness Guide. You can see it online. We've already advertised it. You'll hear about it from Matt Federici from the Copeland Center. So that's going to be on June 16th. It's a historic event, the adaptation of RAP for a particular crisis like this. And then on the 16th, we're going to have one on empowerment in crisis. It'll include Ruth and her team, Michael Ballister, Rob Statham, and Larry Huckmore. And it'll focus on shared decision-making, psychiatric advance directives, and RAP. So anyway, now we can finally get started. Again, I want to thank my friends here and our heroes here. Mark Salzer, and all of you are going to introduce yourselves, please, and as you would like. So we have Mark Salzer here, who I will say something about Mark in that he raised his hand. So I'm going to turn it over to Mark Salzer. But I will say he's really, I'll get this out, Mark. He's the director of the Temple University Collaborative on Community Inclusion for People with Psychiatric Disabilities. Only one of the many things he does, but he's a kind and generous person. He always comes to our events and is very gracious to join us today.
Thank you, Harvey. I wasn't raising my hand to interrupt you. I was just raising my hand to say I'm Mark, even though it has my name here. But anyway, I wanted to thank you, thank NIAPers, thank Tanya and Steve for being a part of this conversation today, and for NIAPers for always being a shining light in our field, not only in New York State, but nationally as well. I also want to thank Harvey for acknowledging the current situation in our country, and say myself that Black Lives Matter. So I am going to share my screen, You are not going to be getting a big PowerPoint presentation here. I won't be reading from slides, but I did want to share some resources with you, which is why I pulled this up this way. What we're hoping to do today, this afternoon for a little while, is have a conversation about the connections and engagement in meaningful activities that hopefully you've all been a part of, and hopefully you've all been supporting one another with, and people you're supporting since about the middle of March or maybe early March in certain parts of New York State, given the current COVID-19 situation. What happened in the middle of March for me is as we were seeing what was happening around the world in terms of calls for social distancing, one of my first thoughts was actually a concern about what social distancing, what that term was really communicating to people, suggesting that we needed to stay away from each other in some way, rather than physically distancing from one another, but especially now staying in touch with one another and continuing to support meaningful activities, meaningful engagement in lots of different ways. Work, if that's going on, education, leisure, recreation, relationships, faith, all of these kinds of things are something that our center advocates for all the time. And we think it's especially important right now. And that really led us on a journey where we started pulling together resources for how to support connections and remote community participation. Community participation that can happen while physically distancing from one another, that can still happen now during the COVID situation. It can happen while we're opening up, and probably can happen well into the future, whether COVID is impacting us or not. These are additional ways that we can support ourselves and we can support other people in maintaining participation, even while not doing it in necessarily traditional ways. So this, like I said, led us on a journey. We've been hosting dialogues around the country, North Carolina, Delaware, Washington State. We're doing one in LA County tomorrow. And we're happy to partner with NIAPers and do this with you all today. So I'll be sharing some of the resources we've been pulling together and hopefully getting you thinking about some of the things you're doing. I know that there are a number of programs and organizations that are promoting connection and participation now, and I'm always uplifted when I see all of these and hear about them, and we'll be hearing about some of them today. Later on, after we talk for a little while, we're going to open it up to us as a community, where you can share what you've been doing in terms of promoting connections and community participation in your own program or agency or organization or your own life, as well as ideas that you have for promoting connections and community participation in the future. Again, we're not talking about just now. What we can do now, we're talking about what we'll probably end up doing or needing to do in the next 6 months, at least, and probably things that we can do for well into the future. So with that, I'm going to move things forward. So actually, I did want to encourage you to use that chat feature that we have. We're trying to promote dialogue. So you'll see a little button on the bottom of your screen that says chat. Click on that. Make sure the two buttons says all panelists and attendees. You might need to move that so you don't just send it to the panelists. And send a message, tell us who you are, where you're from, what program you're in, and you can start putting in chat some of the things that you've been doing right now. In Pennsylvania, we did this, and a peer specialist in the state and an individual who lives in a residential program said that they put together a potluck. They organized a potluck in their residential facility where individuals were asked to make a meal to share with others. They dropped it off individually at her door, so they maintained physical distance. She brought it into her unit, and then she invited people one by one to come in and share food or get food that other people in their residence had made. And she had a quick check-in with them. So these are some of the real innovative things that are happening now. So please start sharing those things by chat that you're doing. And later on, we'll be opening it up for those of you who'd like to speak as well about the things that you're doing. So the first thing I wanted to do is point out this document that we've developed, and I'll share the link to this document later on when I get back to the chat feature. This is a document that we've developed that lays out or lists some of the resources that are out there in all of the areas of community participation. So I just wanted to draw your attention to it. It might inspire new ideas. And again, the idea here was to think about how we can promote community participation, connection, engagement, and meaningful activities while people are physically distancing from one another. As Harvey mentioned, these issues of inclusion, community inclusion, even if it's done remotely with high-tech, low-tech, or no-tech solutions, these are social justice issues. Access to employment, to education, to relationships, to faith. All of these are social justice issues, and community inclusion impacts people's health, all of our health, everyone's health. Working is good for our health. Learning things is good for our health. Faith, if that's what you're interested in, is good for people's health. Leisure and recreation is good for people's health. So this is a medical necessity. It's also a social justice issue. One of the first things we ran into as we talked about these issues is people were reminding us, which we know about, that a lot of people in the mental health system do not have access to technology. So one of the things that we've laid out in that document is the importance of paying attention to technology. How do we get people smartphones, sometimes phones beyond Obama phones? How do we help people get extended data plans, more time on their minutes, all of these kinds of things. So we're listing some of the resources that are out there nationally. Locally, you might have some additional resources, both statewide and also in your local counties and municipalities as well. Access to technology is a social justice issue. It's something that we need to pay attention to all the time, not just during COVID-19, but constantly. And hopefully one of the lessons that we're going to learn from this situation is the need to pay attention to this all the time. So these are just some of the resources that are out there. And again, you can look at this document or look locally, partner with folks locally about other resources that are available. The next thing we started hearing from people is a lot of folks who are being supported by peer specialists or non-peer providers or other people, is that folks were didn't have familiarity using Zoom or WebEx or Skype or FaceTime or all of those things that unfortunately some of us have gotten to be expert with these days. And there are online resources, ironically, that are available to teach people how to use these resources. And again, just like with access to technology, it's a social justice issue to support people in using technology as well. We're really big fans and encouraging peers, especially, to support one another in using technology. Some of the people that I know who are most expert in technology are people with lived experience. So really supporting people in connecting with each other to learn how to do these things and support one another along the way. So this is a list of some of the resources that are out there to think about using technology. And the next couple of slides, I'm just going to go through really quickly. We're identifying different domains of community participation and ways that you can think about staying connected or engaging in these activities while physically distancing, either in person or online. So we do have our high-tech solutions. There actually are volunteer opportunities that people can engage in virtually or through the internet, online, those kinds of things. There's an organization called volunteermatch.org that can help connect you to volunteer opportunities. There are low-tech solutions. We mentioned one right now. You can be engaged in civic life through politics right now by contacting your representatives, maybe work with NIAPers and spend some of that time that you might be engaged in commuting or going somewhere else to contact state representatives, your governor, those kinds of things, and talk about issues that are important to you, or be engaged in political campaigns as well. That is a low-tech way of being engaged in your community. And some no-tech solutions that we also list in this document include when you are able to get out of your house, walk around your neighborhood and clean up. This is one of the things that I do. I pick up garbage sometimes when I'm taking a walk or walking my dog. And I feel a little better when I pick up a little bit during the day. One of the more gratifying things that I've observed during this pandemic is faith communities have been much more willing to move their services and opportunities to be engaged in faith online. I have been promoting this for a long time, because there are a lot of people with mental health issues where it's difficult to get to the faith community. Either it's hard to get up or hard to get there for some reason. And a number of congregations would say to me, they felt that the spiritual component of their service would get missed. And thankfully with COVID, they've realized that you can still engage in your faith community online. And in fact, a number of congregations are having even more people show up for services than before. So here we list some of the high-tech solutions. Almost every congregation has put a service online. You can actually use your phone to pray with other people by phone, and there are no-tech solutions as well. Leisure recreation, there's all sorts of high-tech solutions to this, all sorts of great leisure involving technology, computers, smartphones, all of these kinds of things. We list a bunch of these things in this document. Low-tech solutions involving the phone, or no-tech solutions doing puzzles, all these kinds of things. So there's lots of opportunity to stay engaged in leisure and recreation. Lots of opportunities to stay engaged in the arts and cultural opportunities. I have participated in a couple of concerts that different orchestras have put on, or musicians have put on. I'm a big fan of the Indigo Girls, and but hadn't heard been to a concert of theirs in about 25 years. And I participated in a community of Indigo Girls fans about 2 months ago. Early on, there were about 50,000 people I was on Facebook Live with, and it was pretty incredible. So there are these types of opportunities to be engaged as well. Lots of ways to be engaged with family and friends and loved ones using technology. We're hearing more and more people are staying in touch with family and friends more than they used to before. Using FaceTime, Skype, other technology. So again, it's really important to support people in all of these areas. And I think the last topic is education as well. There are online courses, ways to learn things, podcasts, all of these things that are available. And we can take this time now to support each other in doing these kinds of things. So the last thing I wanted to say is, New York State, NIAPers has been a proponent of Strive for 5. I actually don't know where that stands right now, but it's a way, my understanding of it is the idea is to support connections of maybe 5 people who agree to be in contact with each other, maybe daily, I hope, just to check in, see how one another is doing. We're big fans of that. We also encourage maybe adding to that, or making sure that they're also talking about, what are you doing today? Are there interesting things that you might be doing? Is there a podcast that maybe we'll all agree to listen to and we can talk about it tomorrow? Is there a course we want to take? Do we all want to watch the Indigo Girls concert or the New York Philharmonic and talk about it tomorrow? Is there a game we want to play together? To have there being meaningful activities with this as well, that it's not just about wellness, which is important, but also about what folks are doing. So I hope that those, there's some new ideas there, new things that you haven't thought about. And again, we're looking for you to share some of the things that you're doing right now in the chat box. And again, later on, you'll have an opportunity to share some of these things verbally when we open up the audio lines as well. So Tanya, why don't I turn it over to you to share some of the things that you guys have been up to?
Thank you, Mark. Hi, everyone. My name is Tanya Stevens, and I am the Deputy Director of the Mental Health Empowerment Project. And just very briefly, we are a peer-run organization. Our administrative offices are in Albany, but we have programs throughout the state that both provide training to other peer-run agencies on a variety of different topics, including sort of startup and administrative issues to training direct staff. We have a peer support specialist training series that we provide twice a year in both Westchester County and the Capital Region. And then different, consultation or training for direct staff, again, throughout the state. We provide direct service as well in a couple of different counties through a variety of state and county funding. And we have what the state refers to as recovery centers in Westchester County and Rensselaer County here in New York. And the idea of the recovery center is that it's services without walls, if you will. So leading up to COVID, we were people that were 100% one-on-one in the community, providing direct care for people. We did not do virtual things, not because we didn't have the capacity, but because that really wasn't our mission. Our mission was that we go to where people are, work with them in their community, at their home, at their residence. We provide, in-person training, in-person consultation. That was really one of our strengths, honestly, is the amount that we were mobile and out in the community where people needed us. We were in several jails and prisons, state hospitals, local hospitals, probation, parole, clinics, all of those places. So when COVID hit, it was a real adjustment for us because it's not the way that we have traditionally provided services. The other thing, and I just want to sort of mention this to keep in mind, I think, is that peer programs did an amazing job, sort of under the radar, of overnight changing the way that they did services to best suit the communities that we needed to. Sort of without attention and without fanfare, we just did that. And I think often it's because we're used to sort of chaos or working in that way, and so it's much easier for us. But I guess what I want to spotlight about that is we have the same concerns as other organizations about the safety of our staff, about, frankly, the liability for our staff, the liability for our community. Some of the expectation, I think, is that, well, peer programs can do this. But what does that mean for our own staff and their safety, their anxiety? In many ways, we become essential frontline workers without the notoriety of being essential frontline workers. So most of the peer programs I know stayed fully operational in the community, serving people in much the same ways as other providers, but we still had to consider what that meant for us. We've been operational since the very beginning at our recovery centers, and we had to figure out how to do that with appropriate social distancing, with appropriate care for our staff, with appropriate, concerns about people who maybe couldn't meet the new requirements. And so I just want to mention that there are concerns around this as well that are very real concerns. And I feel like sometimes it's, well, peers jump into action and do this, but we have to do it while also running an organization. So what we did was expand. We pulled all of our services back in-house, if you will. We had a number of community groups, and then again, one-on-one activities that we were doing with individuals. So we expanded our service hours so that we've been operational from 9 a.m. to 9 p.m., 7 days a week. with telephonic peer support at both of our centers. And then we operate a 24-hour-a-day warm line that has been operational the entire time. So after 9 p.m., you can still access somebody, but it's going to be via our warm line. So the phones have all been sort of transferred. During the day from 9 a.m. to 9 p.m., we have 3-4 different people that are working at any of the centers and are able to answer calls and talk with people. We also have currently 7 virtual peer support groups that we've been running since March that are operational 7 days a week. And they happen from 8 a.m. through, I think, 9 p.m. is our latest one. The community just asked that we add another one, so we're going to do that as well. And we have a real consistent community of people who have been joining those virtual support groups and have really been participating in that Zoom platform since March. We run a Hearing Voices group as well. We are the Hearing Voices chapter here in New York State. We had an in-person group that we were running and we moved that virtual back in March. And we also have an Alternatives to Suicide group that we've been running virtually since March that happens once a week. Again, we were running that in person, we moved that virtual. Similar issues, in some ways our experiences, Zoom is a great platform and providing this virtual entity is a great platform, but it's not just issues of accessibility that keep people from using it. We were working in a lot of rehabs, community residences, again, in prisons, places where, halfway houses, places where even if people have a phone, they're not allowed to use it during the day at any time that they'd like to. So it's not just an issue of minutes or technology, it's also an issue of really meeting people where they're at and understanding that those rules don't go away simply because COVID has happened. So working with a lot of these entities, having a relationship and working with them to say, how can we best support people? You know, if technology, whether it be hardware or whatever else is an issue, how can we support people around that? If not, what are some of the other levels of support that we can provide? So we also started telephonic peer support groups. For some people, Zoom just wasn't an option. Even if they had a phone or they had access to the internet, it wasn't an option. So in response to what the community asked for, we started just telephonic peer support groups. We've also worked with a couple of different county jails. I mean, we were very concerned about what was going to happen to individuals who were incarcerated, who had no access to visitation, to any of the things, you know, not just the high rates of COVID infection, but also that they were completely going to be shut off from any sort of community that they had. So we already had standing relationships in Westchester and Albany County. My experience was it was better to not work directly with the jails to sort of circumvent the jails. So we went directly to the Albany County Sheriff's Department and the commissioner down in Westchester County, so that we didn't get caught in sort of a bureaucracy of what the jail will and will not allow. And we were able to reformulate some funds. I know that, you know, you can't just sort of come up with the technology that you need for people, but saying we can provide one laptop or one iPad for the time being, if you can pull together and allow a space in one particular room, is a lot easier than how can each individual have access to something. So we tried to circumvent some of that technology issue by saying we can provide this for you, and we can reformulate some of our funds either via the county or the state to be able to provide this for this period of time, because we're not doing X, Y, and Z service, but we want to best serve our population in a different way. So we did do that, and we did that locally with a couple of hospitals here in the capital region as well, and then a couple of different residential programs where, you know, we were running groups in person, and so we said if we could just preserve that same space and time and provide you the technology, would you afford us the room and still allow people to come into the room in the same way, and be able to just kind of either talk via telephone or via Zoom, so that we can just stay connected and talk with people about, you know, what they're experiencing right now. We also now run a virtual peer support group and a telephonic peer support group specifically for frontline staff. So this is sort of outside of what we've done in the past, but it had come up as an issue that individuals who have been working this whole time, and really just both the ideas of what grieving and loss means, but also the stress of having to continue to work and not really have an option, and just everything that's happening, that they would like their own space to be able to kind of talk about that, minus a supervisor, minus whatever. So we offered this space I facilitate that group, and you know, we have a pretty good turnout of people who have been coming, participating, engaging with that. Let me see. We've also, because we have physical space, so we have a building, a house actually in the Troy area, we've been collecting and distributing supplies for people in need. So people in our community that need, you know, toilet paper, or sort of essential supplies or dry goods or whatever. We're fortunate enough that we had sort of a shed out here outside of the building, and we've been boxing, collecting that, and then allowing people to come and pick up things as they need it, as they articulate it, because a lot of the early calls that we got from people were people who were very concerned about their ability to be able to get some of these, that even if they could get to the store, and many of them couldn't, you know, they were concerned about the needs that they were going to have. So we have been sort of collecting and redistributing to people, not in a mass kind of food drive sort of way, but just in our own community for people who are reaching out and making sure that we have those available. Let me see. We also do a group text. So Arby was talking about the meditation that NIAPRS does. We have a mailing list, an email and an actual paper mailing list of events that are happening in both of our centers that go out monthly. And with things changing, we still sent that out, but we also collected phone numbers from anyone who was interested and created a sort of group listserv text of morning sort of check-ins and listservs, so that we were able to reach out to people and just give them, you know, here's your thought of the day or check-in or that sort of thing, just to keep people connected in that way. Remind people of our hours or expansion or new offerings or whatever, just to make sure that we were doing, you know, what we could to reach out to people. We also have a number of social media groups. So there are, you know, for each of our centers, and then the organization as a whole, we have Facebook chat groups. And a lot of our community is very active on that, even minus us at this point. They've sort of spun off on that and created their own support and their own engagement around that. And so that's been really successful. I don't know if I missed anything, but I do just want to say a couple of other things. So we are now on the verge of reopening. All of our staff is full-time from the centers. We are and have been working on figuring out how we can resume one-on-one services. So we will begin bringing people to our centers. We're fortunate, again, that we have, you know, physical land space and also a couple of very large decks here at our building. So our initial idea was that we would bring people one-on-one, safely social distance. You know, our staff, frankly, is very anxious to get back to work and some normalcy. We'll be keeping our extended hours, but we really would like to get back out in the community and start meeting with people. In saying that, you know, a lot of what I've participated in is focused on, you know, the move to kind of virtual trainings and telemedicine and work, and how that opens up a lot of opportunities. And I do agree that there are opportunities. And so for us, we'll probably keep many of our virtual groups because there's a real opportunity in reaching isolated populations around that. That said, I caution us between focusing on that too much, because the real power of peer support is not in virtual groups and telemedicine. The real power of what we do is that we are where people need us to be, and we do build these one-on-one relationships with people. And so finding a compromise between, you know, what could maintain moving forward and also being that entity that we've been historically is where we're trying to find a balance. And I you know, for us, we don't want that balance to be to continue having 5 people answering phones. Ideally, you know, we have 1 answering phones and 4 that are out in the community really doing the work that we pride ourselves in doing. And again, it just in the reopening aspect, I emphasize on the tail end of it as well, we have to take into account our own staff and the safety of our own staff as well. And I think far too often the idea is, well, peer programs can do that or should do that. And my comment, and I don't mean to be trite, is always, well, would you ask your own staff? Would you ask your clinic staff to do that? Because if you don't feel like it's safe for your clinic staff, why would it be okay for a peer to be out doing those things? So figuring out, it's you know, and it seems as though we shouldn't have to emphasize that, but I think that we do, that it's okay that we hear about things that peers have been doing all along that are exactly what we're operational to do and exactly what we want to be doing. But are we also considering, you know, the safety of the staff themselves and making sure that both from an organizational liability standpoint, but just the sheer safety of our staff, you know, what are we doing to make sure that the entire community, us included, is staying safe? So I think that's all for me.
Great. Thank you, Tanya. Steve Michio is called in, so that's why you're not able to see him, but he's hopefully pulled over on the side of the road. So Steve, do you want to go?
Sure. Pulling over in a minute, but hi everybody. I'm Steve Michio, the CEO of People USA. We used to be called People Incorporated. We changed our name. We have more of an international focus now in the work we do. So we are a peer-run organization, and we provide a multitude of different peer support services, from housing to crisis management to respite to jail. We're you know, pretty much what Tanya was saying is we do a lot of that as well. And we also are a partner in running a stabilization center in Dutchess County, New York. And then I think we serve, I know we serve 9 counties in New York State. And we're in the process of building a medically supervised detox in New York to serve 6 counties. And that's an ongoing process. And that is going to also be a peer-run, OASIS-funded detox. So pretty much what Tanya said is what we've been doing. We went virtual right away. And it was, for us, it was a no-brainer. We upgraded our phone systems. We upgraded our Zoom accounts. We just, you know, improved our technology. We have an organization that works with us in improving all technology, especially the phone systems. We went 24 hours on our warm lines. We always had 24-hour warm lines, but we expanded in different regions of New York in serving folks. And then the stabilization center that we are partner in is run by 5 different organizations. And so, unfortunately, with the COVID, you know, I saw it as essential, but then staff at the stabilization center were infected, and so that affected our service delivery, and that went to a telephonic service as well, which was unfortunate. But the one thing we did keep was we provide all of the crisis intervention team training for officers in our community. And if officers were still picking up folks and that were in crisis, they continued to be allowed to come to the stabilization center because we did still staff it. It just wasn't as rich a staff as we usually have. And so we did have people from law enforcement coming into the stabilization center this whole time, which worked pretty well. The challenge we had was our forensic team in Westchester County. They are a peer-run forensic alternatives to incarceration team. They're a crisis stabilization team that's mobile. And that was really hard to do telephonically, so we didn't. The staff still were meeting. That's a relationship where we have a strong relationship in the White Plains area with several police departments. When they come in contact with somebody that's in crisis, whether it's addiction or mental health, they would call the team and they would meet the officer and that person in the community and work on a crisis plan for that individual. So that really couldn't stop. We couldn't figure any way to not do it, and the staff were willing to continue. It wasn't as robust as it usually is. There was more telephonic work that was going on, but they were still meeting people, you know, with the personal protective equipment and safe distancing. And so that did continue, and that was really successful as well. And as we're coming out of this, you know, reopening, you know, we're continuing our you know, our safety as written by the Department of Health and federal government. So we're following all the standards still. The one area that we really struggled with was our respite houses. We did have to close them again because of staff being infected with COVID. And We couldn't run them effectively, so they did go 24/7. So then we went to another platform, as Tanya was talking about, with the virtual meetings and virtual one-to-one. I have over 85 staff, and they were all given the names of people that we're serving, or they know the people they were serving, and they were reaching out constantly, daily if needed, or whatever that person was asking for, to stay in touch with people and help them through this, the pandemic. And that was very effective. It was very effective when staff would just, on a daily basis, are calling folks and saying, how are you doing? Is there anything you need? And we were helping them with their basic needs of, food. And there was a lot of confusion around entitlement services for some reason, Social Security. So we were doing a lot of entitlement services and advocacy with folks. So nothing really slowed down for the staff. That was the incredible part of this, is that we all stayed very busy communicating, connecting, holding different groups, different types of groups every day. And our attendance went up tremendously in the Zoom calls, also with the phone calls. We went from, averaging about 200 calls a week to over 600 calls a week. And so that's been steadily rising. As if 80 days has gone by. So it was really about just adjusting. And as Tanya said, I think a lot of the peer groups just took it as a no-brainer to say, this is what we have to do. We have to stay connected to our community. We too are going to continue the technological work that we're doing. However, we're going to, again, focus on our face-to-face and our opening our houses again. They're actually opening next week. As long as the phases are working well for the communities in New York. And staff are already coming in this week to the offices and getting prepped, working individually in offices, and starting to get ready for the full reopening, which we hope will happen soon. So with that, that's what we did. We responded as quickly. The one thing I did do was I noticed that a lot of the professional community was really struggling. We had suicides, an emergency room doctor and psychiatrist. And to me, peers are peers. People are with lived experience or people with experience. And I didn't see a lot of support. I saw some support, but I didn't see a lot of support. So I hooked into a Canadian organization, and they we're running these support groups, and I just put that on our social media to let professionals or traditionals or doctors, nurses, first responders know that there was another outlet for them to get support. And that got some pretty good feedback and usage with that company. So that was a nice company to partner with. They were called MindWorks, or are called MindWorks, and they've been really helpful in helping that population of the community. So that's what we've been doing.
Thank you, Steve. Thank you, Tanya. That was great to hear what you guys are up to. And as you were talking, I was thinking about something that I've been giving a lot of thought to the last couple of months, and that's the notion of disruptive change. Actually, I was thinking about it just before this pandemic happened, that a lot of significant change that happens around anywhere happens because of major disruptions, where things that we were doing before, we just have to stop. So I mentioned faith communities. They would say, no, 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 we can't do it this way. And I would say, you're missing a lot of people who want to be part of your congregation. And they say, no, we can't possibly put services online. And they figured it out. And again, I think they figured out that in some ways there were some good outcomes from it, and they're not going to stop having face-to-face services, but I'm hopeful, I hope that they keep in mind what they've learned during this pandemic and have some options for online participation as well. And I know Steve and Tanya both mentioned maintaining some of the changes or some of the things that have occurred. Steve, as you were talking in particular, I was struck by a housing program that I'm engaged with and do some support of. And what they've realized, it's actually a homelessness program, so supporting people who've been homeless, coming into housing, and they've moved to, as much as possible, virtual communications, phone communications primarily, and they actually had a 20% increase in contacts with people. 20% more contacts that they had before. The contacts were for shorter periods of time, so fewer minutes, but they had many more contacts that they had before. And I actually think that that might lead to better outcomes in some way, that the more touches we have, at least we know this in other areas, that the more touches we have, the more contact, that might lead to better outcomes. And I don't know if that's something that folks are experiencing in your programs, but it's something to think about. So I do have a couple of questions, but I wanted to remind people that we now have the opportunity for you to share some of the things that you're doing, and a number of you have been doing this. We heard about some picnics while physically distancing and other things that are happening. So please go ahead and share those on chat, and we're going to provide opportunities in just a moment to open up some of the audio lines. What you need to do is raise your hand. So you go into participants, you go down to where it says raise hand, and that'll let us know that you'd like us to unmute you and give you an opportunity to talk. And again, the idea here is, and there's a lot of great issues that people are raising, a lot of concerns about what's happened over the last couple of months with COVID, and a lot of concerns about opening and reopening. But I would like to encourage us to stay focused on meaningful activities. How are we supporting people in work, in education, in leisure recreation, in social relationships, with family, with friends, with faith, with citizenship, all of these kinds of things as well. So would love to hear those ideas. And somebody also raised the issue about access to technology and use of technology. We would really love to get examples of what you're doing to support people around technology. Sometimes we've just gone, oh, what are we going to do? People don't have phones. People can't use them. And would really love to hear what you're doing to support it. I'm particularly interested in that because some folks, peers here in Pennsylvania, I'm in the Philadelphia area, are this might be a major initiative. So I'm also trying to steal your ideas and share them with our Pennsylvania peeps as well. So put stuff that you're doing in chat, and why don't we try to, oh, Harvey wants to say something, and then Eileen will try to open up some of the phone lines as well.
Just a quickie, there is on our website, back in March 26th, we did a presentation kind of polling peer agencies throughout the state. The PowerPoint is called Tips on Serving Individuals Remotely and in the Community During the Virus Crisis. And there's a lot of ideas similar to what you're hearing. The one that stands out we haven't talked about is online 12-step groups. Those are heavily used. So I just want to point that one out in particular. But check out the PowerPoint. There's a lot more detail there.
Great. So Eileen, why don't we try to see how we can do with audio? And again, please keep it coming by chat. And the panelists, we're going to be reading some of your chats and pulling out ones that we want to make sure we read out as well. So Tanya, Steve, I don't know if you have access to the chat, but Harvey, Ruth, anybody. But let's try to open it up to Robin. And I'm not sure, Robin's had her hand up for a long time, so I don't know if she wants to speak or just accidentally hit raise hand. But why don't we try, Robin? You might want to unmute now. I think you've been given an opportunity to unmute. So bottom left-hand side of your Zoom, there's something that says mute and unmute. So Robin, I'm not sure, we're going to move on, but keep trying to unmute. I think you still have permission to unmute if you'd like. So we have, and I don't know how to pronounce your name, so Olfadja, I think if you can try to unmute, bottom left-hand side of your screen is a button, and I think you're given the option to unmute. now. Or Eileen, if you want to try to unmute, I think we can do that too sometimes. All right, see, we're also learning the technology here.
Yeah, this is Ruth. I just wanted to let you know that I'm trying to unmute people, but I just can't seem to do that right now. So we're getting in touch with Eileen to see if that's something that she can help us with.
Okay, great. Yep. So please stick with us. Raise your hands. We're trying to get you to be able to speak as soon as we can. But Tanya, Harvey, Ruth, I don't know if you've seen any ones you wanted to read out. I did want to ask people again, sharing, especially around technology. I mean, we know a lot of people are using technology. There are a lot of online self-help mutual aid groups, but there's still the issue about how do you support people in using technology. Somebody's asked where I'm from in Pennsylvania. I live just outside the city on the west side in Wynwood, Pennsylvania. But I've pretty much been in Wynwood straight, haven't left my little township for almost 3 months now. And I travel a lot, but you know what? I'm actually just fine.
Mark, can I add something? This is not on the technology issue, though I can address that. It's just something I forgot. One of the other needs that we sort of discovered is individuals who are currently residing in homeless shelters. So traditionally, most people need to leave the shelter environment by a certain time in the morning and can't return until evening. So there's both the issue of COVID contamination and keeping people a certain distance apart, but what do people do during the day? Historically, a lot of people have gone to their local library or other places that they can hang out, or to 12-step meetings, all of which became null and void with COVID. So both working with the shelters to make sure that they had what they needed as far as masks and different cleaning things, but then with the individuals who are leaving shelters during the day, where were they going? I mean, at the beginning of this, remember, the weather was not all that warm to be directing people to just be sitting in a park. A lot of people rely on, even if they have a phone, the free internet that comes with different places that, like the library, or different places where they could get a cup of coffee. So, we found that there are a number of people who might be staying in a shelter who have a phone, but they need a Wi-Fi. And the shelters themselves don't have the Wi-Fi. And there was no place to direct people other than to sit outside a library to be able to access Wi-Fi. So it wasn't even an issue of people not having the hardware. It was the resources that people had in place to be able to access these things were null and void. They didn't exist during this time. And how do you direct people, how do we support people as a community that don't have these places to go and things to do that really rely on them very much, like during the day. So some of the things that we did was that we did direct outreach to these populations, the sort of local shelters, both in Rensselaer County and Albany County and down in Westchester County, worked with them about finding alternative sort of spaces and collaborating with each other so that we could redirect some people to be able to use Wi-Fi. So like maybe, let's say the City Mission here in Albany doesn't have Wi-Fi. They do have a room where people can hang out during the day, although people often don't use it. So how can we work with them to best utilize that space and be able to access, we were able to give them actually a hotspot so that some people, or loan them a hotspot so that some people could have Wi-Fi access during the day and be able to use their own phones, even to contact their own family. This wasn't just an issue of how do we keep people connected to our virtual groups. It was ways in which they are connected to their own communities and were no longer able to do so because the ways that they had learned to access those things were not available to them.
Thank you,
I just want to say
Tanya.
that when Wi-Fi went down, I wound up spending time in the parking lot of the Dunkin' Donuts or the McDonald's, where I was able to get out.
Yeah, and again, these are issues that were pre-COVID, during COVID, post-COVID. We've really been encouraging folks to engage. This is a larger issue too, beyond folks in the mental health system. And there are people in our communities that are working on access to technology and resources. And we've really encouraged a lot of partnerships around advocacy, to do some advocacy in those areas as well. And Tanya, people were asking where you were from. So MHEP, Mental Health Empowerment Project in the Albany area, and probably elsewhere throughout the state, all over the state. Whatever you guys need, MHEP will be there for you. A great organization. So it looks like we might have been able to get some folks open to be able to speak. So Ofaja, I hope I'm pronouncing your name correctly. It sounds like you're unmuted. Okay, maybe not. So Andrew, it looks like you're unmuted.
Yes. One of this. This is just something that I thought about because the virus. We all noticed, how it forced us to. We had to be apart from each other. But the great irony is we realized how important it was for us to be connected with each other, the importance of community. And we talked about, faith-based ideas. So it really helped us to realize, to love your neighbor as yourself.
Thank you, Andrew. Thank you for sharing that. All right. I think we don't have a lot of hands up. So I'm just trying to look at some of the chat and yeah, Harvey? Are you giving me
I just want to say that we did a
hand?
webinar some months ago during that series, and Peggy, what's that? Can you hear me okay? Okay.
Yes.
So we did a webinar early on with Peggy Swarbrick, who you may know is the developer of the 8 Dimensions of Wellness. And she asked a question on one of these, and the chat box was open, and said, do you want to share what you do to keep yourself well? And in 2 minutes, she had 81 responses, and I cut and pasted them, and they're actually different. So I left my email address here at harveyr@niapers.org, and it's a long list of things that people are doing to keep themselves well. That isn't about connecting with others. It's more about what you can do for yourself. So again, if you want to see it, I'm happy to send it, harveyr@niapers.org.
So thank you, Harvey. That's great. Would also love to hear or see what people have folks post in chat, the kinds of ways that they're continuing or new things that they've done from a community participation and inclusion standpoint. So if there's new work that you're doing, or you've taken an online class that you have never done before, or somebody, Maria Teresa wrote that she is crocheting. So that's terrific. And again, I mentioned one person in Pennsylvania put together a potluck, again, that didn't involve, it maintained physical distancing, but people were able to share and still maintain some community that way. I mentioned the Indigo Girls for myself, that's been really nice. I've been doing something called jackbox.tv. So it's something that you can do. I've been doing with my family. And again, we certainly can think about this in terms of wellness. I usually think about it in terms of community participation. This is the way that we're part of our communities, leisure, recreation, education, meaningful activities, and certainly, hopefully, there are things that bring us wellness as well. I know some people who have been doing co-participation, especially with walking. So I actually, with somebody on Facebook who I know out west, he was taking a walk through a park. And it was a park that I know I'd never be in, and he was doing it on Facebook Live. And I was getting ready to go to bed and just started watching, and I couldn't stop watching him, and I would put some things in Facebook Live every once in a while and say, hey, this is great. And sorry, there's my dog welcoming the UPS delivery person to my house. She's not always very welcoming. So anyway, it was great. And I know people who are doing that, those virtual walks. I think Tiffany was responding to that. But I think that that's also incredibly creative as well. Folks are doing decluttering now, which is great. I don't know if people have taken any classes or signed up for anything, started listening to podcasts, started volunteering. Somebody started, I think it is Jasmine, a Facebook group called, and I'll give it a plug, Jasmine, I guess you put it out there for everyone, Amazing Wish List, where people post their Amazon wish lists and people buy things for each other. So there you go, get on Amazon wish lists that Jasmine's put together, and do a good deed, and maybe buy something for somebody and make their day. That's a terrific idea.
I noticed the list that Peggy has. There's a lot of meditation that people are doing, a lot of walks. Somebody's wrestling with their cats. Sounds like a good idea. I'm just looking here. Adult coloring. There's a couple there. People are doing hikes, yard work, horseback riding. I think I know what that is. Jogging for sure. Writing letters. Gratitude journaling, I thought that was really sweet. Spirituality, cooking when they haven't cooked before, scavenger hunts, meetups online, I don't know what that is. So just, there's a number of things. And if you want to share, in the chat box or to my email address, please do. Because people are interested in that.
Well,
Yeah, they seem to be doing a lot of stuff. We've got Tracy, who's learning Spanish right now via Rosetta Stone. We've got Miriam, who's actually doing ECPR. And then there's also talk about free classes that people are doing online.
Yep. Harvard Online, somebody mentioned, Tiffany mentioned that. Charlinda mentioned taking courses, online courses, and volunteering in a community garden. Volunteering, there is some recent research that came out that suggests that volunteering is good for all of us. It's good for our health, mental health and wellness. So we've got a couple of folks with their hands up who'd like to say some words. My friend Kate. Kate, did you want to share some things? Kate Hewlett?
Hi, yes, good afternoon. This is a comment from minutes ago. So I just wanted to say that I try to look at the positive of negative situations, and I think it's amazing that prior to COVID-19 and all of us working remotely, there was a lot of pushback on the state level and like on the organizational level of telehealth, like implementing it. But we all kind of figured it out, and I think now I do believe in person is more effective and the way to go, but sometimes, especially like in rural America, sometimes like that's a barrier. So what I would like to see moving forward is hopefully we can maybe like send out surveys and really and not focus on the negative, but kind of like ask what didn't go so well so we could plan for the positive, plan for how can we make this thrive and flourish, and then bring that on the higher organizational level to really sell this so it can continue and really be a billable standard instead of an emergency situation.
Thank you, Kate. All really great points. And, one thing I might add to that is I think, face-to-face, I learned about self-help, peer support about 30 years ago by being able to be an observer in a group, an organization called Grow, and it was pretty incredible. Really, it taught me everything. Really, everything I do is based on what I've learned from people with lived experience. But I also do know that some people like that online contact and peer support as well. So some other folks, Melinda is also taking classes. I actually don't know what CUCS is. Harvey, what is that?
Center for Urban Community Services in New York City.
Awesome. Let's see. Shari's taking YouTube yoga. that actually reminds me that I've been doing a lot of YouTube workouts lately too. So that's great. Maria Teresa started an herb garden. So there's some great things. Cooking classes from YouTube. I've definitely heard people getting together, supporting one another in cooking. Sometimes trying a recipe together and sharing how it worked out. So people are doing that together, which is pretty awesome as well.
Mark, can I say one thing? This is a shameless plug, but now is an excellent opportunity for people to go onto the Academy of Peer Services website and complete your training requirements and then get your certification application in if you've just not had the time or not been able to do it. You can contact, I think Mariam is on this webinar and put some information in the chat box for APS, or you can contact MHEP. We oversee the certification, but now is a great time. Both of those have been live. The certification application is now online, so you don't even need to send in a paper form. But all of that information has been available, and this is a really good time if you have access to the internet to be able to, for free, get your peer specialist certification.
Tanya, thanks for saying that, because we've been doing a lot of that in our organization. Staff have been catching up, so I appreciate you saying that. Just so everyone, I have to sign off and thank you for the time, and thank you, Mark and Harvey. This has been great. So
Thank you, Steve.
good luck to you all.
Thanks, Steve. So I have 212. And again, there are some folks who are talking about, and I actually don't think about virtual peer support as telehealth. I view telehealth as being other types of virtual communications, but certainly telehealth or non-face-to-face peer support is not for everyone. And I imagine that there probably are some concerns and things we should be wary about with it. Some folks have mentioned that, but Harvey, Ruth, wanted to turn it back over to you to close things out.
Thank you, everybody. Thank you, Mark, for coming on and all your great work, especially at this time. And Tanya, the same. It's so great to keep learning about all the things MHEP are doing and all the kind and the range of things that you're doing. I just want to remind people that the next webinar next week on the 10th is an exciting webinar. It takes WRAP, Wellness Recovery Action Plans. The people who are affiliated with that have made an adaptation for COVID. And Matt Federici from the Copeland Center in league with the Advocates for Human Potential will be presenting that June 10th. And June 16th, Ruth and her cronies are going to be putting on a workshop called Empowerment in Crisis. And they'll be talking about shared decision-making, psychiatric advance directives, and WRAP. I do hope, in the time, during these times, that people use all these means to take care of yourself. It's such a challenging time. I know I've been traumatized by all these not the marches, but the looting, and just I've also been inspired by the marches of people, from all walks of life and backgrounds. So, but this is a good time to stay together. NIAPRS is a big tent. We have been for many years. It's a big family. Please feel a part of it. Reach out anytime. We're there for you. Okay. Be safe. Be well. And we'll talk soon. I think, Ruth, you want to close out?
I just want to thank everyone, and please be gentle with us as we work on your CEUs. We really appreciate you joining us for each and every webinar. Thank you all so much. Have a wonderful day.
Goodbye.
Goodbye. Goodbye. Thank you.